I've introduced a tool which is doing interview. AI is doing the interview and it is giving me shortlisted candidates. So we have trained that AI so that it is able to give me the shortlisted candidates. Out of 100 people, 10 are shortlisted. But those out of those 10, humans are shortlisting because we have to train AI also. It is also like human being. There should be a balance of high tech and high touch. Design thinking, you have to get the complete processes in place, and you get a customer and you implement those things. Get the persona of the people and then you implement it.
So one leadership quote you live by?
Woods are lovely, dark and deep, but I have promises to keep.
Oh.
I have to go to miles before I sleep.
What is that differentiator between a manager and a leader?
You caught me now. Manager is going by the book. He operates on a tick mark activities. Leader
I'm delighted to welcome Dr. Jagmohan Rishi to our podcast. With over 25 years of leadership experience spanning executive business roles, L&D, digital transformation, and as a coach to CEOs, Dr. Rishi brings a unique blend of strategy, human-centric and future-facing thinking. Today he joins us to explore how the pharma talent and learning ecosystem can evolve. So welcome Mr. Rishi.
Thank you very much.
Dr. Rishi, you have worn so many hats. Business executive, L&D leader, coach to CEOs. How did your path evolve into focusing on people development and learning?
Very interesting question. Thank you very much for having me on this forum, Pharma Now. And this has been a continuous journey. Frankly speaking, many times I have heard that you should have a goal in mind and then you achieve it. That definitely works for me in my personal and professional life. But my journey, which has evolved in such a manner that I have been curious to come out of my comfort zone and keep on learning and innovating. And that's how, as from a sales representative in one of the multinationals, I moved into a training role, then I moved into a L&D role, then moved into a marketing role, and of course digital strategies as well as a coach. So the one mindset which has always been with me was growth mindset. Keep on learning new and challenge yourself. And that's how I moved into people development. I was managing people as a team of a sales leader. But when I saw that I can contribute more to the society by getting into learning and development field, leadership development, that's how I moved into learning and development, leadership development and coaching. And now I am able to create more leaders through my current profile as a president of BMA, as a global head learning and development, and as a professional coach also.
So what do you think, like how important is having that growth mindset?
It's very important whether you are a professional, whether you're an entrepreneur or a homemaker also. Everywhere growth mindset is very, very important, because working with a fixed mindset कि ऐसे ही काम होता है, तो वो that will not help you grow further. So always have that curiosity and always be ready to learn and be humble, because I at a senior level can also commit a mistake. And if I can learn something from my junior, from somebody who's just come out of college or Gen Z and Gen Alpha also, so I am very much open to learning. So growth mindset is something one should always be open to learn new things, experiment new things. I was just in this forum and there were 3 agencies, and they only told me that I am a great experimenter. So I had given opportunity to all the 3 agencies when they started initial journey, and today they are doing very well, got funded, going to US and UK, and that's exactly what it is. I can continue.
So you say you are a great experimenter.
I am a great experimenter. One should take risk. That's how growth mindset happens, and keep learning new things, because if some people say that only classroom training is good, virtual training is not good, that again is a fixed mindset. So today during the COVID times it was only virtual training. Before COVID, it was classroom training, but now it has come into hybrid mode. So one should be open to keep on experimenting it. So I have decided that I keep on trying new ways of classroom facilitation also, virtual facilitation also, and one-on-one coaching in a face-to-face manner or also in a virtual manner. So my personal mission, if you see my social media handles, is to create almost 100,000 leaders in this world who can make a difference in this world to make a better place. Today world is in chaos. I don't want to mention about it, but it is in chaos. I want some leaders who can take forward, be it political, be it administrative, or whatever leaders they are, they should be able to create a difference in the people's life. That is what I believe.
Okay, great. So I was there on your during your book launch also. So I can see a book over here.
Yes.
So sir, is it a part of one of your experiment? I can see real deals, real stories by Dr. Jagmohan Singh Rishi. So this is the book, and today it got launched. Congratulations for it,
Thank
sir.
you very much.
So is it part of one of your experiments?
Yeah, this is also part of my experiment because my first book which came was Are You a Digital Dinosaur? Now that was on the digital transformation strategies, which was need of the hour. And I rolled it out and it became Amazon bestseller. I'm very happy that I've donated all the revenues of the book to a foundation which supports the widows of Indian Army. And same is going to happen from this book also. This book is a very fast 1 hour read. You can read it while you're traveling also. This has got my personalized example of stories of coaching. I'm coaching to a salesperson, I'm coaching to a CEO, I'm coaching to a marketing manager, and also I've given some templates. If you go to page 72, there are some templates you can self-evaluate yourself कि आप कितने पानी में हो with respect to competencies. So this you can immediately get instantly where you need to improve upon if you are truthfully evaluating yourself. Okay, at the same time, this is for young leaders, and young leaders talk about, they need to be trained on leadership, but this particular book will give them ideas how I can coach my team and how I can develop that team. And I've given some templates at the end they can refer it and make successful of their life. And wish you all the best by reading this book, and may you have a successful careers.
So I also saw there was a little fan moment happening over there where you were signing the copy. So I think after this podcast, I'll get my signed copy also.
Obviously, sure, definitely. That was a fan moment. I was very emotional. People were literally, flocking on me to get my sign. I was feeling like a celebrity, and I really loved it. There were tears in my eyes, of course.
Great. Congratulations, sir. Okay, moving on to your work on leadership development and digital learning. How do you think organizations in pharma need to think differently compared to other industries when it comes to upskilling and capability building?
Okay. You see, pharma is a very unique field wherein we work on evidence-based selling and of course evidence-based research. So the strategies here have to be little different compared to FMCG, BFSI and other aspects. So that's how we have created strategies. Initially, pharma was a digital dinosaur. They were not implementing any kind of digitization. So that is from the digital perspective. At the same time, people in pharma, there's a way of selling in pharmaceuticals. It is called medical representatives way. So earlier the focus was purely on product oriented selling, evidence based selling. I am not saying we have moved away, but today with the advent of AI and with the advent of technology, now our customers, they are already aware of the medical aspects of the brand. So it is important to develop the soft skills part. So in clinic effectiveness, communication skills, how to develop a rapport, how to ask persuasive questions, how to handle the objection. These are the skills which we need to develop in today's people. And this is equally relevant whether you go for the production floor or where the where the US FDA audit kind of happens. So we need to develop them the skills in them also, how to face the audit confidently. Many times, US official, FDA official, they ask a question and the person becomes jittery and not able to answer it proper. In spite of that, they know the answer. So that body language, your executive presence, your demeanor, that should be very, very clear and confident. Look into the eye of the person. This is what we are developing these days, kind of thing.
Okay, so I'm really intrigued to learn why digital dinosaur, the word dinosaur. Your social media also says, are you a digital dinosaur? So why dinosaur?
Frankly speaking, there's a story behind. Can I tell you the story?
Yes, please.
I was in Kuala Lumpur and I had gone there on an invite to the CEOs, the scientists, the general managers of the industry, pharmaceutical industry, and I was giving a talk. There in my introduction, they said that I am in charge of leadership development and digital transformation. And during the question answer session, maximum questions came on digitization. And very few questions came on leadership. That time I decided, give the market what they need. And I have got a life coach of mine. I consulted with him when I came back. I said, this is what my observation is. And he said, do what your heart says. And we debated, we discussed, and we finalized the name, are you a digital dinosaur? It is a question. Many people misread it. The dinosaur means big. So digitally you are very large. No, dinosaurs are extinct.
Okay.
So that is where the meaning of the book is, are you a digital dinosaur? Well, are you digitally extinct? Because if you are not upgrading yourself, you will become a dinosaur.
Oh, okay.
So that is where you have to keep on upgrading. This book gives you transformation strategies for a CEO, for a salesperson, for a medical person, for supply chain. Different chapters are there for that book, and that is how it became Amazon bestseller. And when you are mentioning about the book, my next book is coming on what is your elemental vibe, and this is particularly for Gen Zs, and because it talks about the personality psychometric analysis of the people, and it in summary I say, you are not asked this question but I am answering it. It talks about everybody has a element. For example, I may be having a fire element, you may be having a water element, he may be having an air element. So everybody operates from the different elements. So that is how I have shared some more aspect of my forthcoming book also.
My element is air.
Your element is air. Wow, that's good. I will give you a survey of it. What your profile talks about it.
Oh, okay. Great. So when we talk about building a learning hub in pharma, one where talent is developed not just for today's role but ahead of tomorrow's disruptions, what are the 3 ingredients which you'd emphasize?
Yeah, very, very important in a learning hub, particularly for pharmaceuticals. Very, very important is that we explain about the content part it. We let them experience it. One is we give them the content, we let them experience in the training sessions, and then they implement it and they come back to you. It is not one-time activity. So content, experience, implement. These 3 aspects are there. So once they do it and they come back with the aspect, and that is how I am focusing on these strategies. And if we are able to implement in this kind of 3 strategies, I think every learning organization will be successful.
Okay. So digital data and learning are converging rapidly, from AI-driven learning, micro-learning modules, immersive experiences. How should HR and L&D in pharma navigate this shift without losing that human touch in it?
Very good, very good, very good question. I always debate upon that whatever strategies, whether it is human resources or learning and development, there should be a balance of high tech and high touch. That is something. So you can't have only high tech strategies, you can't have only high touch strategies. So with advent of AI, it is becoming very easy to shortlist people through AI. I have introduced a tool which is doing interview. AI is doing the interview and it is giving me shortlisted candidates. So we have trained that AI so that it is able to give me the shortlisted candidates. Out of 100 people, 10 are shortlisted. But those out of those 10, humans are shortlisting it. So that is here we have, because we have to train AI also.
Yes.
It is also like human being. So we have to train it, and as of now the testing is going on, and that is what it is important, that you have to balance between high tech and high touch.
High touch. High tech and high touch.
Yes, yes, yes.
Okay. So could you share an example of a transformation or a learning initiative you led that significantly changed how people learn, behave, or perform in an organization?
Yeah. I will talk about one initiative which we call it LEAP initiative.
Leap.
LEAP is an acronym of leadership, empowerment, accountability, and performance.
Oh.
This was in this era of high tech. We did a residential 11 days workshop for the mid managers, mid to senior managers at one of the center, and they were brought from their headquarters, trained for 11 days. It is unheard of these days because nobody conducts manager development program more than 3 days.
Yes.
I did it for 11 days. We not only did a content workshop, but we made them practice through role plays. And I started by giving them a personality psychological profile called DISC profile first. I am a certified coach, and I gave them a briefing of that kind of thing also. Based on that, there was experiential workshops done over there, and initially people used to ask me, sir 11 दिन क्या करेंगे हम लोग, and हमारा काम कैसे होगा? But as we did multiple batches, they were able to realize how much they have to learn, and we invested in people development of the leaders, and that changed their mindset, and that is the reason the performance increased after that, people retention increased after that, and the culture also of the organization increased. That is one of the very, very important initiatives which is very close to my heart. Not only that, I mean technologically, I evaluated the effectiveness of it about seeing the performance and attrition level. Both the parameters positively showed me the results. So that is how it is very close to, and today also people call me, they are in touch with me, sir, that was a transformational program for me. And not only we did learn from the classroom from other trainers, but also you personally coached us, and my personal involvement was very high because I was trying to see each and everybody's change in that person, and that contributed a lot in the transformation of the leaders and the managers. I will say that particular program transformed them from managers to leaders. And I will say not only that they were performing managers, but they are performing leaders now.
Wow.
That is how it.
What is that differentiator between a manager and a leader?
You caught me now. Yeah. Oh, there is a one term which I will call it. You know, there is a dialogue from a movie, from Shahrukh Khan's movie. जब किसी चीज़ को शिद्दत से चाहो तो सारी कायनात आपको उसको मिलाने में साजिश करती है आपकी. तो वही that is a key difference. And manager is going by the book. He operates on a tick mark activities. Leader उस शिद्दत से काम करता है कि मेरे को I have to develop this person and I have to ensure that I have to take the team together in my performance. Manager क्या करता है? वो manager will go there and he will do as per the SOPs only. There is no heart in that. तभी बोला high touch. तो in leader, the person is very passionate in selection of the right candidate, in development of the right candidate, and in ensuring that I have selected that person and I will ensure he or she performs. That is where the difference is. Manager क्या करेगा? वो select कर लेगा, 2 महीने के बाद develop भी करने की कोशिश करेगा. In case the person is not performing, he or she will change that person. That's the key difference.
And I really want to emphasize on this part where you said not just hiring but also the person is performing after that. So evaluation of whether that person is performing or not is very important.
Absolutely.
And I think that there is a gap in doing these things, and people should make most out of it.
Absolutely. You reminded me of another initiative. I call it a excellence blueprint, which is, I will always say, in a company, the best trainer is not from L&D. The best trainer is the immediate manager,
Yeah, correct.
right? The boss. You must have heard that people do not leave companies, they leave their bosses.
Yes.
So if the boss is compassionate, boss is a leader, the people will not leave. I have got great examples of my team members who have stayed with me more than 5 years. And they have stayed with me because of me, not because of money. And I take the responsibility of their development and the career, and of course in the later stage of the career also. They are still in touch with me. I guide them, I coach them. Another a best practice I can share with you is that what I do is whenever I select a person, we do a reference check for the person, you know it. I tell the person, my name is Jagmohan Singh Rishi, this is my LinkedIn profile, and you can go in the market and do a reference check about me. If you feel the reference is good, then you join my team.
Is it?
Absolutely. I'm very transparent, I'm open, that is exactly what I want.
Great. Great managers build great team.
Great managers, great team, definitely. It makes a lot of difference, my dear.
So for pharma organization facing skill gaps, regulatory pressures, field force change, hybrid workforces, what would be your 3 strategic focus area for HR and L&D for next couple of years?
What 3 strategic areas in pharma focus? I will say the 3 strategic focus area will be that one is upskilling, because the market is changing very fast. And uske liye the leaders, the L&D leaders and the business leaders, they have to become little pagal, so that they are also upskilling themselves and they upskill their team also.
Yes.
Number 2 is to focus on not only the outcome but the processes part also. This has been always there, but what has happened is because of the short term perspective, many leaders are losing their focus and they are focusing on short term successes, which is not right. They should be focusing on the long term success in the process of people development. And finally, belongingness has to be there in the team. They have to work along with the team, not to the team. There are 3 strategies which will take. One is upskill, that is on the capability building. Number 2 is on the Number 2 is on the processes, and number 3 is on the connect part, I'll call it.
Okay, so as you said that more than L&D is responsible, the immediate managers are more responsible. So can you share one tip for those immediate managers or for those leaders who want to upskill their team but they also want to upskill themselves? So one tip for them so that they can also manage both upskilling themselves and their team also, along with managing all the tasks.
Yeah. I think the best tip I can give is you read my book. But other than that, I will say that what you can do is, ideally speaking, first thing is one should be able to read people very well. So if you are getting a team by default, spend time with them. During my time when the digitization was not there, my manager asked me about my pain areas, personal life, my goals, my expectations, and he helped me in development, making me what I am today. Today the leaders do not have time for this. I would want them to spend time and walking the talk. They should be transparent that this is my limitation. For example, if you see my WhatsApp status, it says I am flawsome. So it doesn't say I am awesome, but I am flawed, still I am awesome.
Okay.
Okay, so that is where exactly it says that हर कोई बंदा perfect नहीं होता है. And at the same time, it is important that when once I am looking into my self appraisal, then at the same time I build a processes that I clearly tell my expectations to my team members कि भैया हमको ये करना है and we have to do it together. Okay, you have been selected in this company to do this job. Okay, there are KRAs, there are OKRs, there are KPIs. ठीक है, कंपनी के वो फॉलो करो सिस्टम, बट एट द सेम टाइम ए डिफरेंट काइंड ऑफ टीम स्पिरिट, द बॉन्डिंग, द कनेक्ट हैज टू बी क्रिएटेड बाय द मैनेजर एंड एक्सपेक्टेशन सेटिंग ऑल्सो बाय द लीडर, सो दैट दे आर एबल टू कनेक्ट विद ईच अदर एंड परफॉर्म टुगेदर. भैया जीतेंगे साथ, कहते हैं ना, डूबेंगे साथ नहीं, डूबेंगे नहीं, जीतेंगे साथ, इकट्ठे चल के जीतेंगे.
So talking about the OKRs, sometimes the priorities changes as months goes by or quarter goes by. So should the OKRs should be the same, or it should be pivoted, it should be iterated along, or it should be carried forward?
Okay, this is not a session on OKRs or KRAs, but still in brief I will talk about it. That the advantage of OKRs is that it can change. There are some certain KRAs from the organizational perspective, they become sacrosanct. But the execution part of the KRAs, they can change the way we have to do it. But the whatever strategy we started in the beginning of the year, by second quarter, those can change. The market conditions have changed. So you have to be flexible enough to change your OKRs and track them on a regular basis. That is what I would want to mention about it. OKRs are more flexible compared to the earlier performance appraisal management system. So that is the reason I give more importance to OKRs than that.
But it should initially serve the initial goal.
Yeah, the goal has to be sacrosanct. Goal has to be sacrosanct, the pathways can change.
Okay.
Okay, मुझे हिमालयस पे जाना है, अब मैं इंडिया की तरफ से जाऊं या चाइना की तरफ से जाऊं या नेपाल में से जाऊं, goal is sacrosanct.
Got it. Okay. So for our listeners in pharma, HR and L&D, if you had them focus on just one thing right now to build a sustainable learning hub, what would that be and why?
There is one aspect which is one skill which is required for pharma professionals is that you innovate yourself. Okay. At the same time, do not limit your development purely on digital or purely on that human aspect. So I would say that you should be having, like I mentioned earlier, having a growth mindset, and at the same time, more importantly, that you build up processes which are transparent. Today the era is of visual dashboards. So dashboards should not be serving the purpose of the senior leadership only. Dashboard should come down, float down also. So dashboard should go down also, so that they can be seen by the execution leaders. So it makes the implementation easier. Now what has happened is one trend which has come up, that some of the companies have implemented only digital managers now. Now you see, whatever execution strategies are happening, there are nudges which are sent by the digital. Okay, bhaiya, your call average is this much, please improve upon it. Your incentives are less, your target is less. So digital managers are sending this nudges. However, I am not in agreement with that. That can be there, but these nudges can be followed up by the human managers also. So do not replace the human part of it. Build technology wherein you can get nudges and you can get dashboards, you can get ideas which are there accordingly. Another aspect which I will bring is that normally the pharma domain is head office specific strategies. I would say get input from the other departments also. Head office marketing and head office sales guys. If you include the field guys also, zonal managers, medical reps, medical training, production also, into the strategy, you get a complete 360-degree view of the customer. And I'm a great proponent of design thinking. Now in design thinking, you have to get the complete processes in place, and you get a customer and you implement those things. Get the persona of the people and then you implement it. I think one suggestion I can give you is that they can start using design thinking in their approaches.
Great. Okay, so we are moving on to our last segment, which is rapid fire round.
Okay.
So one leadership quote you live by.
One leadership
Quote you live by.
woods are lovely, dark and deep, but I have promises to keep.
Oh,
I have to go to miles before I sleep.
I sleep. That's really
Robert
great.
Frost.
Yes. Your favorite food?
I love parathas, aloo paratha to be exact.
Aloo parathas. Irreplaceable tool or tech you can't live without.
One tech,
One tech or tool you can't live without.
WhatsApp.
WhatsApp. Favorite hobby outside your work?
I love outside my work. I love spending time with my family, and that is very rare because my work is spending most of my time. Like you are taking a lot of time for me. So I try to spend time with my family, my wife, my daughter, my mother. So I mean, that is what I try to be there.
One word that describes the best for you.
Describe best for me.
Yeah, like describes you the best.
I do not know what people say about me, but
Experimenter.
experimental is one thing which I can talk about it. I'm a very big risk taker.
Risk taker.
And second word is flossom.
Okay, it was really nice having you, Dr. Rishi. Our audience must have got a lot of insights from you, and definitely they'll be going to check out your book also. So it was really nice
Sure.
having you.